This patch is used to relieve minor muscle and joint aches and pains, such as those caused by arthritis, backache, and sprains. The menthol in the patch creates a cooling and warming sensation on the skin, which helps to distract from deeper muscle and joint pain. It is recommended to use this patch as directed on the packaging for optimal relief. When using this medication, make sure to only apply it to the affected area of your skin. Before applying the patch, ensure that the skin is clean and dry. Do not use the patch on skin that is injured, irritated, or has a rash. You can leave the patch on for up to 12 hours, following the directions from your doctor or the product package. Remember to remove the patch before bathing and wait to apply a new patch until after bathing. Do not cover the patch with bandages unless your doctor tells you to. Avoid using heat, such as a heating pad, on the patch as it may increase the risk of side effects. After handling the patch, be sure to wash your hands thoroughly and avoid getting the medication in your eyes, nose, or mouth. Once you have removed the patch, fold it with the sticky sides together and dispose of it in the trash, away from children and pets. If your condition persists for more than 7 days, worsens, or keeps coming back, be sure to inform your doctor. And if you believe you have a serious medical issue, seek medical help immediately. If you experience redness, mild itching, or irritation at the application site, you should speak to your doctor or pharmacist. However, many people using this medication do not have serious side effects. Stop using this medication and contact your doctor if you experience blistering or swelling at the application site, or increased or unusual pain. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Before using this product, make sure to let your doctor or pharmacist know if you are allergic to menthol or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. If you have plans for surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are going to have an MRI test, it's crucial to tell the testing personnel if you are using this patch. Some patches may contain metals that can cause serious burns during an MRI, so ask your doctor whether you will need to remove your patch before the test and apply a new one afterward, and make sure to learn how to do so properly. If you are pregnant, it's important to use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is also unknown whether this medication passes into breast milk, so consult your doctor before breastfeeding. Remember, always consult your doctor or pharmacist before using this medication, especially during pregnancy and while breastfeeding. It's important to be aware of potential drug interactions when using icy hot, menthol, 5% topical patch. Certain medications may interact with icy hot and affect its effectiveness or increase the risk of side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medications while using icy hot. If this medication patch is chewed or swallowed, it may cause harm. If someone has taken too much, remove the patch if you can. For severe symptoms like fainting or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Make sure to schedule and attend all your regular medical appointments and any necessary lab tests while using icy hot, menthol, 5% topical patch dermatological irritants-counter-irritant formulations. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you are using this product regularly and forget to use it at the scheduled time, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use your next dose at the regular time. Do not use a double dose to make up for the missed one. When storing icy hot, menthol, 5% topical patch. Dermatological Irritants-Counter-Irritant formulations, make sure to keep it at room temperature. Different brands may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's important to keep all medications out of reach of children and pets to avoid any accidental ingestion. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.